Welcome to Prescribed, Healing Our Community. I'm Dr. Natasha.
And I'm Dr. Elena.
And as you can see, Dr. Elena is pregnant and with twins. So because of that, we wanted to bring light to this important subject of racial disparities in pregnant women. So stay tuned and you might find out some information that will save your life.
Welcome back to our channel. Today we're going to touch on racial disparities in pregnant women. Why does this matter, you may ask? It's because, according to the CDC, Black women have a 3 times higher rate of death during pregnancy. Black women over the age of 30 have a 4 times higher rate of death when compared to white women. Among Black women who are college educated or higher, like us, the mortality rate is 5.2 that of white women.
Which is shocking.
Yes, very much so.
Yeah.
In today's video, we'll touch on the most common causes of illness and death among Black women in pregnancy. And those include eclampsia and preeclampsia, postpartum cardiomyopathy, pulmonary embolism or blood clots, and hemorrhage.
So you might ask yourself, what are some factors that are contributing to these disparities of African American women having a higher likelihood of death related to pregnancy? So some of that includes quality of health care, underlying medical conditions, structural racism. So what does structural racism mean? It's a very, very large, all-encompassing topic, but that deals with things like education, housing, earnings, benefits, racial issues in healthcare, and criminal justice, which all has a indirect effect on everything pretty much. And then also implicit bias. So implicit bias means a lot as well. So when we go to see our doctor, there are times where even perhaps unbeknownst to them, they have certain biases within them to where, you know, they're looking at a Black woman and saying, well, I think they're strong enough to handle it. Oh, you're in pain. They probably can handle it. I'm not going to give them as much. They'll be okay. And those are some biases that exist within lots of people to where that's how we're treated. And that goes back pretty far, right? To where they always thought that we perhaps had a larger pain threshold than we indeed do.
Right.
So those are some of the factors that contribute to these disparities. All right, so let's delve into one of the major complications of pregnancy for African Americans. So according to the NIH, pre-eclampsia and eclampsia are pregnancy-related high blood pressure disorders. So let's break it down because even I got confused really what the difference is. So pre-eclampsia is when the mother's high blood pressure basically cuts off or reduces that blood flow to the fetus. And so obviously your baby is getting less nutrients and all the things that it needs. Eclampsia is kind of a progression for the worse of preeclampsia. So eclampsia is when the pregnant woman with preeclampsia develops seizures and even a coma. So during pregnancy, preeclampsia can be pretty mild. In the majority of cases, it absolutely is worse for us though, as African Americans. And within a matter of days, it can turn from mild to worse and go into that eclampsia. So we really need to be aware of the symptoms that we're going to go over in this video and make sure that we're advocating for ourselves if anything feels off. So what are some of the causes? That's really unknown. They don't really know exactly what's causing it. There are some proposed factors, some of which include genetics, nutritional, environmental factors. Like we said, race plays a part, but overall, we just want to emphasize that you need to have good prenatal care, be serious about your symptoms, and make sure to report them. So what are some of the risks to the mother? So we're going to kind of divide that up with during pregnancy and then after pregnancy. So during pregnancy, the mother can have damage to the kidneys, the liver, the brain, different organs, and even the placenta. So the placenta at times can actually separate from the uterus, which is really scary and something we want to avoid at all costs. Preterm birth, so early labor, causing the fetus to perhaps be unformed and cause complications after that. And then the worst that we absolutely do not want to happen, and this is why we're doing this video, is loss of pregnancy or death to the mother. After pregnancy, some of the complications could be uncomplicated preeclampsia. So the mother is still at high risk of blood pressure and other symptoms. And usually they can go back to normal within 6 weeks after birth. But the point we're trying to make here is you might be like, okay, I made it through birth. Obviously, that's incredibly difficult, and think that you're kind of, now you just have to worry about your baby, but the ride is not over. You have to worry about yourself and the symptoms after you give birth. And so women who have had preeclampsia are actually at greater risk of having high blood pressure, heart disease, blood clots, which we'll talk about later, stroke after giving birth. And this can develop, preeclampsia can develop within 48 hours and 6 weeks after you actually deliver your baby. And so that's what we call postpartum pre-eclampsia. So there's a lot of different sections here, but basically pre-eclampsia can occur during pregnancy and after pregnancy. Where I always got mixed up is the word pre. So I'm always thinking this means like either during pregnancy. It was confusing. So it's just what it's called, pre-eclampsia, because the pre means before eclampsia, which is the more severe form of this. So just be aware of monitoring your blood pressure at all times, and we'll get into more.
So I've got to be honest, preeclampsia is one of those things that I've worried about, you know, throughout this whole pregnancy, because it happens to a lot of women, and especially Black women. So a lot of people may know someone who's gone through preeclampsia or was diagnosed with preeclampsia or had to deliver early because of it. So I think it is important to know what complications are out there because of preeclampsia and the warning signs that can tell us, hey, there might be something going wrong. So one of the complications of preeclampsia and eclampsia is something called HELLP syndrome. And I think that's something that not a lot of us talk about. And it's not something that you will symptomatically feel, but it's something that the doctors can diagnose if you go in and seek help. So HELLP syndrome is actually an acronym. The H stands for hemolysis. Hemolysis means the breakdown of red blood cells. And that's something they can see if they draw blood when you go in because you're having certain symptoms. So the EL in HELLP syndrome means elevated liver enzymes. And because your blood pressure is so high, it can cause damage to the liver, causing elevation in these liver enzymes. So that's a clear indication that there might be something wrong. Your body is not getting the blood flow it needs to provide nutrients for yourself and break down toxins. And it also, you need the blood flow for the fetus, like Natasha talked about a little bit earlier. The LP in HELLP syndrome indicates low platelet counts. Again, this is something you would see when we check your blood work. We would see the platelets are dropping. Again, a warning sign that something is going on. So it's important that if you're having the symptoms that I'm going to talk about shortly, that you go and seek help, and we can check some blood work, and that can be an indication that there might be some end organ damage that indicates preeclampsia or eclampsia might be coming.
That's good to know.
Yeah. So signs of preeclampsia, and this is where I kind of get into trouble. I check my blood pressure pretty frequently at home, just to make sure everything is okay. A lot of times in pregnancy, your blood pressure might be lower than it normally is before you were pregnant. And unfortunately, there's not a lot of signs that your blood pressure is going up. So you can have a little blood pressure cuff at home. Check your blood pressure just intermittently, just to make sure everything is okay.
Probably the one that goes up here.
Right? Yeah, exactly. They're a little bit more accurate when they're on your upper arm there. Another sign or symptom of preeclampsia is too much protein in your urine. This isn't something you'll necessarily know, but for anybody who's been pregnant, you may know that when you go to the doctor, they collect a urine sample each time you go, just to make sure that protein is not in your urine. So this is another reason why going and getting prenatal care is very important, because this is something you may not have a symptom of, but they can detect it when you go for your prenatal care. Another thing is swelling. This is a hard one because during pregnancy, swelling is pretty common. You might notice at the end of the day, I do, like my rings are tight, my ankles are larger, but this swelling is usually pretty abrupt. So it's out of character of the normal pregnancy, saying, okay, you know, I can't put my feet in my shoes anymore, things like that. And just a quicker onset of swelling than you normally would notice during pregnancy. Other symptoms are headache, So the headache is not characteristic of, normal everyday headaches. It's usually a pretty severe and constant headache that doesn't go away. It doesn't usually go away if you take a Tylenol or lay down, things like that. Also blurred vision. And then some people will get right upper quadrant pain. Next, like Natasha said, eclampsia is a progression of preeclampsia. At this stage, the symptoms are more severe. So at this stage, a woman can develop seizures, which is a very real indication that there's end organ damage because of this high blood pressure that's gone untreated. Also, you might develop a severe headache. So this is worse than the headache that you have in preeclampsia. The vision problems can progress from preeclampsia in eclampsia to partial blindness or temporary blindness. Also, you may still have an exacerbation of that right upper quadrant pain, and then also develop nausea and vomiting. And then you may have a decreased urinary output. So going forward, there are symptoms of HELLP syndrome. As we said earlier, HELLP syndrome is a complication of preeclampsia. Bleeding and bruising can be a sign or symptom of HELLP syndrome, just because, as I said earlier, those platelet counts drop. Platelets are what's important to help your blood clot. If those platelets are decreased, you're able to bleed and bruise a lot more easily. So if you notice you cut your finger, or you run into your end table and all of a sudden you have a bruise that's out of character for the injury you have, you might want to get checked out and make sure things are okay.
That's a good point. Good way of explaining it.
Also, nausea and vomiting. And this can go along with those elevated liver enzymes. So your liver is important for filtering toxins through your body. You can have a buildup of those toxins. And your body's way of getting rid of things is to expel it out via vomit. So if you notice you're nauseous and vomiting, you're past the first trimester at this point. It shouldn't be, the nausea and vomiting from
morning sickness.
Yeah, morning sickness. And so this would be out of character. And also, again, with the headache, with preeclampsia, eclampsia, HELLP syndrome, headache seems to be pervasive through this whole.
We'll say it a lot.
Yes.
So really, just thinking of the worst headache of your life has come up when we research. So one of the bad headaches. So just keep looking for that.
And then extreme fatigue. Pregnancy, it causes fatigue, but this is going to be something that's really outside of normal. Your body's really fighting to keep itself in check. So if you get fatigue that's outside of the normal for your pregnancy, make sure we get checked out. And like I said, it's important for you to get the prenatal care. Make sure to stay in tune with the symptoms that you're having. You know your body best. So if there are symptoms you're having, we want to make sure you go get help. There are ways to diagnose preeclampsia, eclampsia, and HELLP syndrome. But this is not the focus of this video. I really want you to understand that to stay in tune with your body, get help if you need it, and be aware that these complications are there. So we just finished talking about a big topic, which was preeclampsia, eclampsia, and HELLP syndrome. Now we'll touch briefly on some of the other leading causes of maternal death, especially affecting Black people in our community. So we'll touch briefly. The next topic we're going to touch on is Postpartum Cardiomyopathy, also known as Postpartum Cardiomyopathy. So this is a form of heart failure that happens at the end of pregnancy. So we focus on it more so towards your last month of pregnancy and up to 5 months after giving birth. So what does cardiomyopathy mean? That literally just means disease of the muscle of the heart. The heart is a muscle, and that can get diseased. It's important because this risk is higher among African Americans. So even though the risk is overall pretty small, those of African descent, the risk really increases. So we really pay attention to.
It affects that pumping.
Yes, heart's important. And again, so the risk of cardiomyopathy is higher among people who have suffered with preeclampsia, eclampsia, and postpartum hypertension. So if you have those symptoms, stay tuned with these next risk factors or symptoms. So shortness of breath. You may notice that I have labored breathing right now, but it's just because I've got twins pushing up on my lungs. But shortness of breath. You may notice that shortness of breath when you go to exert yourself, walk through a parking lot, climb a flight of stairs, that you really need to stop, catch your breath, and then recuperate. But if this is getting worse over time instead of better, especially after you've delivered your babies, it's important to pay attention to those symptoms. Other symptoms include a cough, shortness of breath when you're laying flat. So if you go to lay down at bedtime and you notice you're really having labored breathing at that time, it may be a sign of a complication. There might be something wrong. And again, back with that swelling. So a lot of times when the cardiomyopathy happens, you've already delivered your baby. So this is the time where your body should be recouping. But if you notice all of a sudden you have swelling, that's also a sign of concern. So you want to get that checked out as well. And then again, fatigue. This is more so than you're up at night feeding your child, changing, things like that. You're just exhausted and outside of what's normal for, your new parenthood. Also, pay attention to your heart. If you notice that your heart is racing or you have skip beats, it may be a sign that something is wrong. And then if you're getting up at nighttime to urinate frequently, every hour, every 30 minutes, things like that, then there might be something going on there as well. And then this is something that you may not notice, but the doctor may notice. If you notice the veins in your neck are starting to swell or they're pumping erratically, then that's also a sign that something is wrong. And again, back to the blood pressure. I like checking my blood pressure, but
that's good.
If your blood pressure drops suddenly, especially when you stand up or you develop lightheadedness when you are sitting and then you go to stand up, it could be a sign that there's something going on. So keep track of these symptoms, especially if you notice these symptoms after you've given birth or toward the end of your pregnancy. It may be a sign of cardiomyopathy.
All right, so next we're going to talk about PEs, or pulmonary embolisms. So you might have heard people like Serena Williams bringing this to light because they had issues with this as well. But what is a pulmonary embolism or a PE? So they are blood clots that block and stop the blood flow of an artery to the lung. So basically they can start in the leg perhaps and then travel up and then lodge in your lungs and basically stop that blood flow, stop you from breathing. They can cause death. So they're very, very serious. So you're at greatest risk for blood clots usually 1 to 3 weeks after giving birth. And that risk actually can exist for up to 3 months after birth. Typically pregnant women are at increased risk of that just because of the natural changes in your body. I mean, you have so much going on and it kind of puts you in a hypercoagulable state. So that's what causes the blood clots. Some risk factors could be a previous blood clot that you've had, family history of blood clots, or just genetic disorder that causes your blood to clot more. Being overweight or obese, smoking always is a really, really big risk factor for getting clots in general, outside of pregnancy as well. And then delivery by C-section. Prolonged immobility, so basically being sedentary or not moving as much, decreased activity. So even if your doctor tells you to get on bed rest, which yes, you should be resting, it's still just maybe making sure every once in a while you're getting up to move, just to get some movement in there. And then pregnancy after the age of 35. That's us. Certain pregnancy conditions or complications, and also fertility treatments as well. So that can increase your risk if you're using something like IVF or hormones, right? So what are some symptoms? So symptoms, these are very, very important, and you'll see that a lot of these overlap that we talked about. But it's good because then it'll be more likely that you'll remember. So shortness of breath. So we said that blood clot might be traveling and up, lodging in your lungs. You're going to be short of breath. You might be, you basically aren't getting the blood flow. So that makes sense. And then also chest pain, right? So again, you got a clot lodged there. So you might have some chest pain and also fainting. Prevention could also include movement for long periods of movement after long periods of time, fluids. That would be something good to just stay hydrated. And those are some ways to help prevent it.
All right. So our last topic, postpartum hemorrhage. So essentially blood loss. This is something that we look at when you're still in the hospital, but it's important to monitor yourself after you go home. This is an obstetric emergency, or like a perinatal emergency when you're pregnant, emergency after you give birth, emergency.
An emergency.
An emergency. And it's one of the top causes of maternal death, especially among Black women. There's primary postpartum hemorrhage, which occurs within the first 24 hours after delivery. During that time, many of us who deliver in a hospital, you'll have nurses and doctors checking on you to see how much blood you're losing, how many menstrual pads you're going through during that time after you've delivered to check on you. But it's also important to remember, once you go home, you'll want to monitor that blood loss. So there's secondary postpartum hemorrhage, which can occur 24 hours to 12 weeks after delivery. So you want to make sure that, hey, your blood loss is not increasing, or you're not passing large clots as you continue to go further away from your delivery.
Right. And if you're not sure, ask.
Ask if this is normal. Ask if this is expected. It's always okay to ask. No question is too small, or you should never feel insecure about asking a question, because especially me as a first-time mom, I've never felt a lot of these things that I've gone through. So always ask that question. And postpartum hemorrhage is reported to occur in 1 to 3% of births. So a lot of women do experience it, but we just want to make sure the blood loss is not too much. So quantifying the blood loss can be kind of difficult, especially if you're unfamiliar with how much is normal, if you haven't had any babies before. But it's important to pay attention to signs and symptoms. So if you start to develop palpitations, that's meaning your heart is beating rapidly, or you feel your heart beating, then it's important to get that checked out. Lightheadedness, or feeling like you might pass out, that's an indication that you might be losing some blood. And then also an increase in heart rate. You may also develop weakness, sweating, more of a racing heart rate, especially as you continue to lose blood. And if it gets worse, you might feel just extremely lethargic, or it's hard for you to stay awake. You can't breathe, you collapse, and then your heart can continue to increase even more than previously. And Black women, as I said, have a higher rate of postpartum hemorrhage, and they can potentially die at a rate that's increased compared to that of white women, unfortunately.
Right.
So these were just this was just a brief overview of some of the topics that really affect the Black community when it comes to maternal health. We wanted to shed light on a lot of these things. A lot of these things we don't talk about nearly as frequently enough, or we don't, I guess, unfortunately, we don't share our stories with each other as frequently as we should, to make others aware of what struggles others have gone through. And I am very fortunate, I feel, so far with my pregnancy, that I've had a really great team of doctors who pay close attention, because I am high risk. I'm an African-American woman. I am over the age of 35. I am carrying multiples, which unfortunately increases my risk of all of these things that we talked about.
And you're educated, like you said.
Right. And so I learned a lot even doing research for this presentation, but also some of the stuff I already knew. But I'll share a story with you. I met a new doctor this week who really seemed to really advocate for my health and my well-being. And I think as a doctor, other doctors kind of brush me off, thinking, oh, she probably already knows this, or she's aware of these warning signs and things like that. And fortunately, I do have a great advocate in my husband, who pushes me to say, you're having pain, maybe we should go get it checked out. I tend to sweep things under the rug, which I know a lot of us do, but they can find some really interesting things. Sometimes the pain is not just a bellyache or something to be ignored. Sometimes when I'm having the shortness of breath, it's not just shortness of breath of pregnancy. It could be something that is far more severe.
And it's not about you, right?
Right.
It's about your baby.
There are little people inside of me that I have to realize that, okay, I have to put my pride aside and take care of them first. And I know that, but we still think I'll be okay, because I always have been. But my doctor really encouraged me that there's no question too small. There's no inconvenient time to either send a MyChart message or whatever EMR, electronic medical record, service you are using, or pick up the phone. There's always someone there on call to answer your questions. And they even encourage me, if I have a concern, just go to labor and delivery. They have somebody there at the hospital that can help evaluate your baby, make sure everything is okay. And you should never feel silly for just making sure that you're healthy, making sure that your unborn baby is healthy, and even after pregnancy, if there is a concern, always get that checked out.
Yes.
So now we'll go into our prescriptions for health, or your prescription for health. So these are the warning signs that we touched on during today's video. Make sure to be aware if there's a headache that won't go away. And usually this is different than the headaches you have in your everyday life. Call someone if you have dizziness, fainting, changes in your vision, a fever, and that's above 100.4 degrees Fahrenheit, swelling in your hands, your feet, or your legs, or your face, thoughts about harming yourself or your baby, trouble breathing, chest pain or a rapid heart rate, severe nausea and vomiting, belly pain that doesn't go away, if you notice that your baby isn't moving like it previously was, vaginal bleeding or leaking fluid during your pregnancy, a change in vaginal discharge during or after your pregnancy, and overwhelming fatigue.
Yeah, so I guess it's time for me to help fill that prescription then. So basically we want you to pay attention to the symptoms that Dr. Elena just mentioned. And remember, this is high stakes here. It's not just about you. Of course, you want to be alive for your baby and you want your baby to be alive. So it's high stakes. Bring somebody with you to the visit. So whether that be your husband or a mother or somebody that can hear what they're saying, this is always good in general, just to have somebody, because there's a lot going on when you're at the doctor. Consider hiring a doula. So what is a doula? It's a trained professional who kind of provides a lot of physical, emotional, informational support to you during your pregnancy and even shortly after the pregnancy. So they know what to ask when you don't even know what to ask. And, they could be a person that you can even call and run things by. So basically you're hiring an advocate, which I think is pretty cool, right?
Absolutely.
And then also your mental health support is crucial. So we're big advocates of therapy here. So, it's a life change going on. So I think therapy is great. Whether that be a pastor, a therapist, exercise to keep your mental health intact. And then ask your doctor, hey, what's the plan? I heard that there's a lot of risk for me because I'm an African-American woman. So what's your plan to monitor my blood pressure, and how many times should I be monitoring it? And just let them know, like, hey, I know I'm high risk, so let's get a plan in place here before we go any further. And they'll be happy to talk with you, I'm sure. So there's a lot of resources that we're going to put down in the links. One of them is to the CDC, where there's a link to hear a lot of different female stories. And that always resonates with us more, that we might remember, like, hey, I heard this lady said this happened and then she went to the hospital and XYZ. So we're going to put that link below in the box. Remember to head over to our Instagram channel. We have a Facebook page now, and then also our website to get more information. And all of those links will be below. Thank you so much for tuning into this episode, as it was near and dear to our hearts. And we really, really hope this helps you, and we really hope this saves somebody's life. So thank you. Thanks for watching. Bye.